Sunny 95. Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 554. Today we're going to discuss something called fistulas, a dental fistula, and it's a little bit gross for those of you who know what it is. And if you want to actually see some photos of what fistulas look like, you can go to thereasonswesmile.com on Monday or Tuesday, and you'll be able to see this show, which will have photographs, x-rays, and that sort of thing. Or you can go to ustreamtv.com right now and watch it live if you'd like. Anyway, before we get started, let me remind you that if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. All past episodes, complete with video, are available at thereasonswesmile.com. And we're streaming live on Facebook. So we appreciate folks tuning in one way or another. All right, now also, in about 10 minutes, we're going to give away free flowers. They'll be delivered from DeSantis Florist. They'll come to your place of business this Tuesday afternoon, and all you have to do is listen a little bit to the beginning of the show, and you'll be able to know the answer to Dr. Kvitko's question. When you call in, you'll have a chance to win those free flowers. Okay? So as I mentioned, we are talking about fistulas. So by the way, some of the questions we're gonna answer is: what is a fistula? Why do some infections become fistulas? How can I tell if there is a fistula present? Why don't fistulas hurt? What is the treatment for a fistula? Can a fistula be treated exclusively with antibiotics? How do I remove one? What is granulation tissue? How is granulation tissue related to fistulas? And so on and so forth. I guess I got a ton more questions. All right, so now let me just tell you what a fistula is. So essentially, a fistula is basically a kind of artificial garden hose made by your body to get pus out of a wound, and in this case, into the mouth. So that's where the pus goes, by the way. You usually notice a bump on your gums, and when you press it, pus comes out. A fistula on the gums is always a sign that something is wrong, and it should not be left untreated, because the infection will spread and continue to destroy bone, which becomes that dark spot on an x-ray. Okay, so remember, it has to be treated, and in more cases than not, you don't even know it's there. Why? Because you don't have pain. And why don't you have pain? Because you have a fistula. So if you have an infection that has occurred at the end of a tooth, maybe one that needs a root canal, can even be one that's had a root canal. But if you have an infection that's occurred up in the bone, at the end of the root, the body sends all kinds of white blood cells to the area, leukocytes, right, to try to kill it. To try to heal it. Well, kill the infection is kind of the same thing. Okay. So, and then what happens is, as more pus grows there, you get pressure, and pressure causes pain. So in some instances, you do get pain, but not all. Because what can happen is your body says, this is not good. So far, we're not getting any relief. So we better figure out a way to cause the relief on our own. And that would be by forming this garden hose so that we can figure out a way for this pus to drain. And once it does, there won't be as much pressure, and our person won't hurt. That's pretty much the way it works. So anyway, once you get this granulation tissue, then if you get so much of it, even doing a root canal on that tooth is not going to solve the issue. So it's a pretty interesting process. It can be very invasive. You can almost think of it as a non-cancerous tumor. Okay, because the way non-cancerous tumors do damage is as they grow, they take up space, and therefore they're pushing the normal architecture that's supposed to be there, whether it's an organ or parts of bone, are pushed away. So this actually creates a huge hole in a person's jawbone, and it won't go away without intervention. Okay, I've done several of these in the last couple weeks, and I have another one coming up. A woman came in. Her previous dentist had said, "Oh, you need an implant here." And I'm looking at the x-ray, and it looks like no. In fact, and by the way, it affected 2 teeth, not just 1. So now she'd be talking about 2 implants. That's relatively expensive, $5,000 for 2 implants, plus another 4 or 5 for the crowns 6 months later. Anyway, I said, well, yeah, you can get an implant, but we're going to need 2. And I said, I think I can save your teeth. What you have is a huge fistula, and there's a lot of granulation tissue up there, and if I clean it all out, I should be able to save both teeth for you. Okay? So that's what she's signing up to do. Now, remember, it's always a sign of something that's wrong, and let me just tell you a little bit about what I do, or what I've done in the last couple weeks for the ones I've been talking about. Oh, let me go to the question, why do some infections become fistulas? They become fistulas. By the way, that's Fistulas. Not that hard of a word to spell. A little bit harder to say, I'm discovering. I could spell it all day, folks. But anyway, so the ones that become fistulas become that way because you've ignored them. Now, you don't know you're ignoring them unless you're going to your dentist. Because your dentist is going to, and also you're not going to know if you are ignoring them. Even if you go to the dentist, if you say to your dentist, I don't want an x-ray today. Because that's the way we're going to find them for you before they become fistulas, okay? Before this infection becomes a fistula, we can see it on an x-ray, and we're going to say that tooth needs a root canal, for example. Do the root canal, it heals itself, and you're all set. But if we don't do the root canal, well, then you get that other process I was talking about, right? And before you know it, you have this big old area. So that's why some infections become fistulas, because you've ignored them. And you don't know you're ignoring them if you're not going to the dentist, or if you are going to the dentist, if you're not letting your dentist take an x-ray, and he or she can't find them, now you're still ignoring it. Okay, so how can you tell when a fistula is present? Well, sometimes you can't, but a lot of times people will notice this little bubble of tissue, this little bump up above an upper tooth or below a lower tooth, and the gums look relatively normal in color, but they just stick out a little bit. And every once in a while you'll notice one that has a little whitish color in the middle. And if you take your finger up there and push on it, oftentimes pus will come out. So that's one reason, that's one way that you're going to know, is if you check it out, you put your tongue there, put your finger there, or whatever. But the most, probably, not the most, but the easiest way to find it is to go to your dentist on a regular basis and let us check, okay? So, now, the question is, can you tell if there's one present? Only if you can see it. Because if you can't see it, then, you're not going to know. So, you're going to have to rely on us. Now, I mentioned one of the questions that I would answer is, can a fistula be treated exclusively with antibiotics? And the answer to that is probably not. And I say that because if you wait until it's big, then it's not going to go away. So we can do the root canal, we can do antibiotics, but if sometimes these are huge balls of gum tissue growing around your tooth, and let me tell you why I'm saying that. Okay, so this one that I did, I think it was this week. Yeah, this one that I did this week. The tooth was at the one end of a bridge. I'd made her this bridge 3 or 4 years ago, and she only has 7 teeth left. And so I wanted to save this tooth at all costs, and she agreed with me that we should try to save this tooth. So what we did, and I'll tell you that in some instances, we just know we're not going to be able to save a tooth. We don't even try. It's just too far gone. What can you do? We're really sorry, but your tooth has to come out. All right, but this woman, her bridge was on 3 teeth, her upper right cuspid, her upper left cuspid, and a bicuspid on the upper left. It had special rings on it to support her partial, and so it was a really important tooth. And if there's any way we could save it, we were going to save her a ton of money, because her partial was going to be scrap metal, her bridge would have to come out, all that money and effort and time she spent would be gone, because this tooth developed an abscess and, most importantly, a fistula. So I told her, we should try to save this. If I can save it, it's going to cost you a lot less money. But if I can't, you're going to spend this money and need all that other stuff that we mentioned. So it's really up to you. What do you feel comfortable with? And she decided to try to save it. So we numbed her up. We have to make an incision, folks. It has to be an incision. You can't just do this any other way. Can't be done through the tooth. Root canal can, but that's the only thing that can be done through the tooth. So, and by the way, I did a root canal as well. So anyway, I made my incision. First I did the root canal. Had the root canal all done the traditional way. Had that done, because that's going to seal off the tooth from bacteria being able to get inside and hide there. Alright, so then I went ahead and made my incision, pulled back, exposed this tooth, and then it was just all there staring at me, and it was just completely surrounding this entire root. I mean, front, back, sides, outside. This tooth was literally sitting in nothing, just sitting in air by the time I got all of that granulation tissue out. Now, I don't know how much longer it would have been before, because this tooth wasn't anchored in bone, the left side of her mouth, the other tooth over there that was the other half of the bridge abutment, that would have snapped off, because all of the pressure, there's no support on the right, you bite into something and it snaps off the left tooth. So getting one half of a bridge, the tooth that supports one half of a bridge handled, it's very important, because you're protecting the other half. Okay, so what we did, and I had to get it all out. I mean, you can't leave any behind. And I'm going to tell you, this was a little aggressive, and it's not even 100% certain that it's going to take, although I do feel really good about it, is I got all that out, and then I took my laser, my BioLase water-lase laser, and I lased every surface of the tooth root that I could access. What I'm trying to do at that point is sterilize it, get all the bacteria off, kind of cauterize it. It's an interesting thing, because normally there are Sharpie's fibers that attach a tooth to bone. Well, there's not been bone here for months or years, who knows. And so the best thing I can hope for is try to turn this tooth into an inanimate object a little bit, as far as the body's concerned, a little bit like an implant would be. Okay, because we can take a big hole in a person's jaw, put bone all up in there, donor bone, put an implant in the middle, stitch it up, and the bone will heal, and the implant will be in the middle. And then it'll be all nice and snug, and we put a crown on it. So I'm trying to do the same thing with this person's tooth. So I took my laser and I just touched every place I could, every surface of that root, and then I packed first cancellous bone in there. That's the kind of the spongy bone that you hear about in the bone marrow. Then I packed some cortical bone, which comes from the outer surface of a piece of bone, the hard part, and I put what's called 6-month collagen that's going to last for 6 months before it resorbs. Stitch that up in there really snug and tightly. Then I put some regular collagen over that, and then I stitched it up real tight, and I took some photos and some x-rays, and it looks great. We now have a situation where we're pretty sure it's going to heal up. She's going to hopefully be able to keep that bridge and keep wearing that partial. It's not 100% sure, but the patient is a nurse. She was very happy to have me try. She understands the deal. And I'm just telling you that you don't want a fistula, because it's very, very invasive, and it's iffy, if it's a big one, whether we can even save the tooth, okay? And in the case of that other woman that came in, I said it would be 2 teeth she's going to lose. So I'm getting the sign that it's time to go to to Dr. Kvitko's question of the day. But let me just make sure I have covered everything that you're going to need to know. And, okay, so here, you need to know that fistulas can occur at the root end of a failing root canal treated tooth. I think I mentioned that. Fistulas are the result of chronic inflammation, one that you've ignored. And fistulas must be removed for healing to occur. It will never heal if you just leave it there. All right, so we're going to do Dr. Kvitko's question of the day. But before we do, well, let me give you the phone number so you'll have it ready to go. 614-459-9769. 614-459-9769. That's going to be the phone number. Before we do the contest, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's Question of the Day.
All right, and the question of the day is, today we are talking about dental fistulas. Which of the following about dental fistulas is true? A. Fistulas can occur at the root end of a failing root canal treated tooth. B. Fistulas are the result of a chronic infection. C. Fistulas must be removed before healing can occur. Or D. All of the above. All right, the winner's going to receive those free flowers from the Santa's Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of The Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. We're doing Dr. Kvitko's Question of the Day. We have callers on the line, and we flipped the coin over the, I'm sorry, my dice. I have my dice here. I don't know why I said coin. I don't use a coin, I use dice. Anyway, and it came up number 2, so that's going to be caller number 2, which was Brian, I believe. Hey, Brian, are you there?
Yes, sir.
Oh, good. We got you on the line. Okay, so, Brian, what is the answer to Dr. Kvitko's Question of the Day?
The answer is D, all of the above.
Right. Brian, have you ever had a fistula?
No, sir.
Did you know what they were?
I've never even heard of them.
Oh, well, you know now. Cool.
Yes,
and
sir.
like I said, on Monday or Tuesday, go to thereasonswesmile.com. You'll see pictures and x-rays of what the heck we're talking about, okay? Or I guess you could just ask your best friend Google.
Yeah, absolutely.
But, hey, Brian, what do you do for a living? I always ask folks.
I work for the water and sewer department in the county where I live.
Oh, cool. Cool. My one of my dental assistants' husband does that, too. She always teases him that he's a turd herder.
Yeah, well, I've heard that term many times.
I thought that was funny. Anyway, yeah. All right. Well, hey, thanks so much, and keep listening, and maybe tune in next week as well. But stay on the line because we have to get that information where we can send the flowers. Okay, Brian?
Good deal. Thank you.
Okay, you're very welcome. All right. So if you're just joining us, I'm Dr. Kvitko. This is episode number 554 of The Reasons We Smile. Really appreciate you tuning in. And if you're just tuning in for the first time, you missed 553 episodes. You can find them at thereasonswesmile.com. Okay, now, so we were talking about, I explained how I removed that fistula from my patient and how I have this another patient. We're about to do the same thing soon. And so one of the questions I said I would answer is, One is why don't they hurt? We talked about that. The other is what is the treatment for a fistula? And in my opinion, the only treatment for it is physical removal. That's the incision, that's pulling the teeth tissue away, physically cleaning it out with a curette, a surgical curette of some sort. And then the next step is putting this bone in. So one of the things I wanted to go over is the question, is it necessary to put the donor bone? And I'll tell you what, there were many years that I practiced where we didn't have donor bone available to us, not easily at least, not where we could just buy it in a little cup, you know. And so the answer would be yes, but your chances of getting total healing aren't as good because there's a chance that before the bone can fill in, new tissue will grow in there. Okay, so the granulation tissue might grow back in there before the bone can, and the reason is gum tissue grows faster, heals faster than bone does. So that's where that collagen came in. When I put that collagen barrier up, I didn't mention earlier, what I was doing and why I was doing it is we needed to slow down the gum tissue from healing so that we could allow the bone tissue to grow. I can't remember the stat, but it's something like gums will grow, 3 millimeters in a week or something, and bone only 2. You know what I mean? So what happens then is the gum gets back inside and it takes up space where the bone should grow, and before you know it, you have the same thing again. So these days, I would say you should never have a fistula removed where there wasn't bone put in that spot and collagen covering it, because that's your best chance of healing. I guess a real small one, maybe you don't need the bone, but if it's, medium to large, you definitely do. Okay. So ask your dentist if you're about to have one what the plans are, and just to kind of make sure you're getting the best possible result that you can. Now, I've thrown around a term called granulation tissue here without telling you what the heck that is. I just realized that. So, I called it gum tissue at one point, but here's what it is. When your body detects an issue, and by the way, if you're watching the video, there's a really nice picture there of what is granulation tissue on that X-ray, okay, at the bottom screen. So, but anyway, when your body detects there's an injury, something wrong, whether it's a split root, whether it's an infected root, it tries to heal itself. Okay, so it knows it has to heal. Let's take a tooth, a split tooth. It detects this little split, says, hey, that's not supposed to be there, and says, let's try to fix that. But the body doesn't have the ability to grow tooth structure. That only happens when we're kids, when your teeth first are forming. So it says, okay, well, I got this in my arsenal. I'll grow granulation tissue. Well, granulation tissue looks a lot like irregular gum tissue. It's the firm stuff around your teeth, but it's all globular, and it just doesn't look right. It looks funny. It is tissue. It's not what's on your cheek. It's more like what's around your teeth, and it grows. Well, that's not going to fix your broken tooth. Body doesn't know that. It's trying, but it's gonna try anyway. Okay. So as that grows, it takes up the space. So it's the granulation tissue that's growing in there that is taking up the space, also known as granulomatous tissue. And when we talked about the garden hose thing, all right, so that garden hose is made out of granulation tissue. So that's a good try. I mean, your body's trying its best, but it's not going to do anything. And so you have to get that stuff out of there. Otherwise, it's just going to keep growing. Okay, that's why I called it a non-cancerous tumor. And I don't think I said cancer. I didn't. It's just similar, because non-cancerous tumors, when they grow, they're still an issue because they take up space. And if it's one that if you have a non-cancerous tumor, say in your lung, well, as it grows, you don't have as much lung tissue that functions. Okay, so that's what I mean by that. All right, so it looks like it's time to go to a break. We are talking about fistulas today, and when we come back, we'll have some more information about it. Okay?
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, General Dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigart from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, we're back. I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 554. Thank you so much for joining me. I really appreciate it. We are talking about dental fistulas. That is a communication between, say, the inside of your jawbone near a tooth, where it has burrowed its way through the bone and through the gum and is now draining pus into your mouth. So I'll have to tell you, I don't get gross that often in the office, but I have had a couple instances where I was a little frustrated with a patient who I said to them, you have a fistula, look at the x-ray, you need a root canal, and they looked at me with a straight face and said, but nothing hurts. And I'm like, okay, that doesn't mean you don't have it. And so then here's the gross part. So I said, okay, well here, let me look at this. So I take my periodontal probe or an Explorer or something, and I push on the fistula, pus comes out, and I take the little instrument with pus on it, and I say, okay, John, would you please lick that off for me? And they're like, what? What are you talking about? That's gross. And I said, but I just got it out of your mouth. You were going to swallow it anyway. Why not lick it right off this instrument? But see, that's a difference, isn't it? That makes people think differently, and they're going, ooh, okay, maybe I should take this seriously. So, anyway, just because nothing hurts in your mouth doesn't mean you don't have disease. And the only way to know if you have disease is to go to your dentist. And the only way for your dentist to know for sure is to allow him or her to take dental x-rays, not just the bite wings, but the ones that show at the end of tooth roots. Okay? So, I think that's important. And, you know, we had Alex Fromeyer on the show last couple weeks from Beam Dental. And, you know, we were talking about how only 40% of the people go to the dentist on a regular basis, and a big part of that reason is because they don't have dental insurance. And so, but I want to tell you this, just because you don't have dental insurance doesn't mean you don't have infections, disease, things that need handled, and you should definitely get it handled. I also used this, and I used it the other day on this woman who, the one I said now has 2 teeth that need this. Either we're going to try to save these 2 teeth, or she'll need 2 implants. And she too said to me, because she was new to me, she was from the other dentist that the patients are now coming to me. And so when she said, but nothing hurts, I said, okay. I said, let me stop you right there. I said, when a woman goes to have a mammogram, it's an x-ray. They go there, they're having an x-ray so that they can see if they have a lump. If the radiologist says to them, Sally, you have a lump in your breast, do you think there's a woman alive that's going to say, oh, but it doesn't bother me, and leave? It's not going to happen. They're not going to do that. And basically what happened with this patient, and even the hygienist that was in the room, which is, enough said, I get it, I need to deal with this. Okay? It's the same thing when me, as your dentist, tells you that you need to deal with it, because it's just going to keep spreading. Like I said, this woman now going to potentially lose 2 teeth instead of 1 because of how she waited. So anyway, yeah, remember you can see these photos. Oh, I even see one of the photos I'm showing here is of a dog's teeth. They get it too, cats. And so make sure you get to your dentist. Come to me if you don't have one. Our phone number is 614-262-9588. But otherwise, it's looking like we're pretty much out of time. Okay, so that's all the time we have today. Don't forget to follow me on Twitter at Dr. Kvitko, and visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.